Celiac Disease by Nicole, Emily, and Alicia. Gluten enteropathy, more commonly known as celiac disease, is an autoimmune disorder caused by sensitivity to the amino acid peptide component in gluten, called gliadin. This results in the immune system attacking the wall in the small intestine, which destroys villi and causes inflammation. Damage to the small intestine leads to malabsorption of important nutrients, vitamins, and minerals within the body. Risk factors. There is a link among many autoimmune diseases. The development of one may lead to the diagnosis of others. There is a 10 to 20% likelihood of having celiac disease if a first-degree relative, such as a parent, has been diagnosed. Also, prevalence of females within the family is slightly greater. Celiac is also the most common gastrointestinal anomaly found in individuals with Down syndrome due to their impaired immune response and abnormalities in the immune system. Type 1 diabetes also increases the risk of having celiac disease. 6% of those diagnosed with specifically type 1 diabetes will also have celiac, but most patients are asymptomatic or their symptoms are passed off as relating to their diabetes. Thyroid disease, more specifically Hashimoto thyroiditis, puts individuals at a higher risk of having celiac. Patients with this thyroid condition who choose a gluten-free diet reported a lower dosage of thyroid hormone replacement due to the healing of the small intestine over time and better absorption of the medications. Gluten-free diets may also lower inflammatory responses in the body and reduce inflammation of the thyroid gland. Prevalence in Canada. Celiac disease is recognized as one of the most common chronic autoimmune diseases in the world. As many as 300,000 or every 1 in 114 Canadians could be living with this disease. However, many remain undiagnosed due to the invasive procedures that include taking a biopsy from the duodenum to have a definite diagnosis. As many as 90% of Canadians are undiagnosed but may be experiencing symptoms. Due to more diagnoses done every year in Canada, statistics show a 35% increase in individuals with celiac disease.
Gluten is found in foods such as baked goods, cereal, and pasta. Gluten is made up of two main gluten proteins, which are gliadin and glutenin, and gliadin is more prevalent than glutenin. These gluten proteins are made up of amino acids. The main amino acid that makes up gliadin is glutamine. Due to the presence of glutamine, gliadin is difficult to digest, which results in large peptide chains entering the lamina propria. In healthy individuals, when gliadin enters the lamina propria, it is converted into deanimated gliadin by tissue transglutamase. Deanimated gliadin is then absorbed in the small intestine and converted into an important energy source for our body. Pathophysiology of celiac disease. The pathophysiology of an individual with celiac disease is essentially where the body's immune response mounts an attack against the gluten that has been ingested, as it mistakenly identifies it as a foreign substance. Then the gliadin peptide found in gluten interacts with the intestinal cells, which allows the gliadin to pass through the epithelial layer of the intestine and activate the T lymphocytes in the lamina propria. The lymphocytes then stimulate an immune response by producing inflammatory cytokines and stimulating B lymphocytes to create antibodies. This immune response consequently causes damage to the villi on the mucosal layer of the small intestine by causing the villi to become flattened and the mucosal layer to become inflamed. This damage also allows for more gluten and gliadin to enter the connective tissue layer and essentially create a positive feedback loop, which makes the symptoms and the disease itself worse. This consequently disrupts the body's homeostasis.
Symptoms. Symptoms range from asymptomatic with mild nutritional deficiency to significant gastrointestinal symptoms. However, the most common symptoms include anemia, deficiencies in iron, folate, and B12, and also vitamin deficiencies, specifically A, D, E, and K. This is due to gliadin found in food containing gluten. Individuals with celiac disease have an immune system that overreacts to gluten in food. The reaction damages the tiny hair-like projections called villi that line the small intestine. Villi are responsible for absorbing nutrients, vitamins, and minerals. When they are damaged, the individual cannot get enough nutrients no matter how much food is consumed. This leads to the deficiency of important vitamins and minerals. Another common symptom, dermatitis herpetiformis, nothing to do with herpes, is a bumpy rash symmetrical over the extensor area of the elbow, knees, buttocks, shoulders, and scalp. Induced by high gluten diets because circulating IgA antibodies in the blood mistakenly bind to the transglutaminase in the dermal papillae in the epidermis. Once bound, neutrophils start an inflammatory reaction. noticed on the skin as the rash. The last symptom is abdominal bloat and gas. As depicted in the drawing in the upper right-hand corner, abdominal bloat is caused from inflammation in the presence of gluten. The effect of unabsorbed vitamins, minerals, and nutrients presents an abdominal bloat and gas. Both of these symptoms can be quite painful to the individual.
A few key points to sum up celiac disease. The disease involves an inflammatory response to gluten that causes villus atrophy and malabsorption. Gliadin is the primary cause of celiac disease, and it is present in gluten-containing foods, and when ingested, it stimulates the T lymphocytes to begin the immune response that causes the disease and the symptoms. Generally, the damage to the mucosal layer is recoverable, and the symptoms are managed if the patient sticks to a lifelong gluten-free diet.
Feel free to pause the presentation at this time to review a few questions. Thank you for watching.